Welcome everyone to the 2023 Global Animal Disaster Management Conference, brought to you in partnership with Animal Evac New Zealand and our platinum sponsor, 4 Paws International. Before we begin, we have a few basic housekeeping items. We want to bring to your attention an important update regarding the conference schedule. There was an error with the Australian times for the New York sessions, H being the remaining session, on the original schedule. Please visit our website at www.gadmc.org for the updated and corrected schedule. The Zoom chat feature has been disabled, so if you have any questions, we encourage you to put them in the Q&A box. This year, we've enabled multilingual closed captioning, so if you would like to hear the presentation in another language, please click on the closed caption icon at the bottom of the screen. We encourage you to use the hashtag GADMCONF in all your social media posts to help spread awareness of the conference. A short evaluation will be made available as you exit the presentation. Your feedback is valuable to us and will help shape the next GADMC conference. Finally, a reminder that this video recording and all other presentations will be available later this year after it has been properly edited. It is our privilege to have with us today Erica Honey, who is the Principal Consultant at Erica Honey Consulting Australia. With 20 years of experience leading and managing in the animal care and veterinary industries, she is joining us to discuss getting your practice ready for a disaster. Welcome, Erica.
Thank you so much and welcome everybody today. Thanks for being here. Okay, so in disasters, we know that many animals and their owners are going to be affected, and wildlife and ferals too. So we have an increasing severity and frequency in our disasters, which are overwhelming our community's normal functions at that point. And so that is us if we work and have a vet hospital in that zone. It also is us if we have colleagues affected by it too. So in Australia, mostly it's wildlife and livestock that are affected by disasters. Then that's usually followed by horses and companion animals. But remember that that can change depending on the type of disaster, the population of animals, and the preparedness of that community. That includes us as well. Please don't be fooled if you live in the city. Disasters can happen there too. So really important to remember that we're always looking at this from a one health and one welfare approach, underpinned by that human-animal bond. And as an essential service, we have a responsibility to be prepared for both because one group will impact the other. So what sorts of veterinary scenarios might you come across? We could see animals coming to our hospitals. We might have teams responding out in the field, or we might even be assisting at another hospital, much like we did in COVID. Planning and practicing help you to be prepared. So let's look a little bit at legislation before we go into the planning aspects of this talk. So what's important to know, in Australia, we have a national AusVet plan for emergency animal disease. But most of our emergency management when it comes to animals is from a state level. So what happens there? We have emergency management legislation that designates a specific hazard management agency per hazard. That organisation may do more than one, like DFAS here in Western Australia. They also have an incident command system when an emergency occurs. So what will happen is we'll have an animal organisation with their own plans. So for example, in WA, that's DPIRD, we have a state level animals and emergency plan that's a support function, and in an operation as veterinary personnel, we fit in underneath them in the chain of command. So the key point here is only deploy with permission, and most of the preparation, communication and connection work is done early on before that emergency during peacetime. You must also be trained as well. It's vital for our recovery and resilience, not just as individuals, also as a community as well. Please note that we have lots of different tiers of emergency management in Australia. We have district emergency management committees as well as local, and sometimes we'll have DEMC regional level plans. Quite often, nearly always, we will have local emergency management arrangements. And the point here is, when I say quite often, that's the animal component as well. Local government is incredibly important for us because they have a huge recovery responsibility. And so much of the work we're going to do will initially be in response because of the legislative acts that they look after, e.g. Dog and Cat Act, but then again in recovery later on as well. So anecdotally across Australia, we currently have minimal veterinary plans, and I'm looking forward to us planning and preparing together. So let's look a bit more now at disaster planning. So we want to address the 4 stages of emergency management, but I look at this a little bit differently when I'm actually asking you to plan. Now, please note, you can plan however you want to. This is the way that I recommend that you do it. So I put prevention and preparedness together in readiness, and I look at it from a 3R perspective. This just helps with the implementation and your staff adopting it, because remember that this is a little bit of change management as well as a safety culture change too. So we have readiness, response, and recovery. And we want to factor in, obviously, our top 2 or 3 risks that we're going to see. We can talk to emergency services about that locally. They'll be more than happy to help you there. And we also want to look at the specific risks that we face as an industry, because we want business continuity, resilience, and of course, really good recovery throughout the whole thing. So we want to think about our medical legalities, wellness preventative approaches, current staff shortages, and this contextualized approach where we look at our veterinary practice and what we can do every day with the resourcing that we've got. For example, the supply chain issues that we have, so many items on back order on the regular. You may want to look at the Australian Vet Association website and download the National Planning Principles for Animals in Emergencies. This will help to guide what goes into your plan as well. So let's start by identifying our stakeholders. Let's begin with our team, and let's go to every single person in the organisation, because nobody knows their job better than the person who's actually doing it every day. They're going to be able to give you the information that you need to get some really good research together, and then as a management team decide on what it is you're going to do in that emergency. So roundtable discussions, certainly for the smaller teams, you may choose to collect that data in other ways for really big organisations, particularly if you've got chains of vet hospitals. And we want to include all levels of employees too. So when we're thinking about our clients, we want to also pay attention, just like Tim mentioned in his last talk, about our vulnerable communities. Now, likely you're already going to know the demographics. You're probably going to get that from your database. You might talk to the local government and rangers as well. I'm sure you've already got quite close connections with that side of it. But we want to think about what their needs are in the emergency, because quite often they're going to need the extra help, and they're also going to be the ones that are going to take our time in terms of extra resourcing. So please note the veterinary social workers there. It is a newer occupation coming to Australia, already fairly well established, I understand, in America. In Australia, it is the Veterinary and Community Care Group, actually located here in Perth, Western Australia, and we're looking at growing this as an occupation to help out not just vulnerable communities, although that certainly is a priority, but helping all of our clients and, of course, our veterinary personnel. Let's also move to external stakeholders. So we want to think about all of the different facilities that can assist us, and we can also assist, because what we want to do is, once we've got our plan for our organisation, we want to also create a community plan together. Now, primarily, I suggest that this is the veterinary hospitals. Link in with your specialist facilities, your other local hospitals, and make a plan together about how you're going to share that patient load and, of course, your resources as well. Now, you've probably already got a lot of this from COVID. That's probably the silver lining to it, is it's helped us with our preparedness. So there we go. You also, as I mentioned, want to speak to local government, volunteer groups if you're interested in deploying. And of course, emergency services, they really will help you, particularly when we come to the preventative side of emergencies as well. Note that when you're working in emergencies, you're going to see more working animals than you probably normally would. Of course, you know that we treat them as very important patients, and so please do be prepared for that as well. So let's now look into prevention, the first part of our readiness. And the biggest point here is that I really want you to take note of the seasonal emergencies. So this is going to change a little bit depending on where you are in Australia, whether you're definitely up north or down south, and what you're going to be potentially experiencing. And the key thing here is you want to get your veterinary property prepared. That could also be you in the city, particularly if you have bushland around you and perhaps a lot of leaf litter in your area. But that's just one example out of many. It's not just bushfire or wildfire for our overseas teams. Of course, it is many different hazards that we might see. And we really want to focus on, as I said, the top few that we might see. And then we will also have some contingencies for the other things that we'll see. Let's not forget biosecurity. We had the initial lumpy skin disease and foot and mouth disease concerns late last year, which 2022, which made us think about being prepared a lot more. Do think about the traffic that comes to your veterinary practice. Even if you're in the city, we still get country people coming in, particularly if you've got a mixed practice or people who own large animals and are coming from properties come to you, particularly with their small animals, if you only see small animal. So think about where those vehicles are going, mechanical boot cleans, the pads of water and disinfectant and so on and so forth. In a couple of slides, you can see the veterinary handbook. You can print that one and that can be your first amazing part of preparation. Pop it in your vehicles, pop it next to each phone, and then you'll have the opportunity to potentially even stop a disease from occurring. It's going to be one vet or one person who notices the first case. So let's now look at preparation and your plan. Now, there is a bit of a list here. It's just to give you an idea of what you might want to consider. And look, this is just the start. There's plenty more, but we do that as we start to build the plan. It's not just one copy. It, of course, evolves as time goes on, particularly as you identify all of the lessons that you're learning each time you practice. And hopefully you don't have to put it to the test, but when you do, you'll gather those learnings as well. So we want to, as we said, identify those risks, know what kind of space we've got to do that, and what kind of resourcing and abilities we actually have as well. So here's the thing. If you can't do something, say it's large animal emergency rescue, that is just not your thing, even though you are a large animal practice, you just don't have capacity or capability, put that in your plan, because what your staff want to know is, okay, well, I'm not familiar with everything, I haven't been here forever. What is it that my boss wants me to do? Okay, we don't do that. Here's the contingency for the group that do. Great, we've got a little bit more care for our community that way. Roles and responsibilities, very important. We want to make sure that each person in the team on that day knows that when they're activated, this is the exact task that I have to do. My leader is going to coordinate me, they're going to assume control, and I am going to go through each of these particular points and start to get them done. Please note that we do want role titles rather than actual names, because unfortunately people do come and go. In terms of communications, always a difficult, sticky point in emergencies, but we can start to head some of that off locally at our area by having perhaps some radios there, knowing that it's hard to make phone calls, so let's automatically go to SMS, and having a chat with your external stakeholders about how you're going to communicate and stay in contact with each other. Here's a very helpful point that is going to save you so much time and stress for your team. Create templates. Be ready to go with the key points that you want for social media, phone messaging, and your website. So what do I mean by that? An example could be emergency started and you just need to have time to have that control and command and start to get it in place. Your phone message could say something like, I'm going to switch the phone off, you're going to leave this message on there, something like this. Thank you for calling us. We are currently responding to the emergency. Your pets are our priority. We will call you very soon with an update. If you have consultations booked this afternoon or you have an emergency, please go to this particular hospital. What that's saying to people is that we have got this, we do care, and we will be in contact with you as soon as we've looked after your pets. And also you want to arrange this with the other hospitals in your area. So really a lot of linking in there as a veterinary community. You want to also have a contact list. Please put the numbers in your phone. I can't tell you the number of times I've been called in the car or at home and had to look it up on Google Drive or on my phone so I can just share a number quickly or give them a call myself. It's very, very helpful. But put that contact list in the appendix and make sure it's really regularly updated every season. From an admin point of view, there's a lot of documentation and legal requirements for us as veterinary personnel. Please prepare for no internet or electricity just in case. So downtime procedures need to be very clear, very well organised, labelled, in trays, out trays. Make sure that you're ready to go for that. And for your financials, that's a really interesting one because part of this, you could argue, should be covered by external parties. But from a veterinary point of view, let's actually have a look at what we're going to do with our clients. So if someone has lost their house or they're not able to pay in that particular situation, are we going to give discounted treatment? What about free treatment? Do we set up a GoFundMe? What are the sorts of situations that we might encounter? What about our budget lines for staff, getting extra staff in or perhaps paying them for more than we normally would in our budget for that particular quarter? Insurance coverage can also be another sticky one. Sometimes we think we're covered for certain things and then we find out we're not. We want to check that beforehand. I'm sure most of you have got it sorted out. It's just good to just double check it. From a welfare point of view, when we talk about welfare in disasters, human welfare, we actually mean food and water for our people, maybe some Coke or a lemonade as well, but make sure that you've got those things ready to go in your emergency kit. Perhaps have some frozen meals in the freezer. Even if your electricity goes off, you'll still have some food there for a little bit. We want to support and give them that extra care. And of course, have those counselling contingencies and veterinary social workers that they can talk to if needed. If we look at the professionals in emergency management, such as DFAs, the people who do it every single day of their lives, most of them, they are incredibly good at their shifts and when they clock in and clock out. They do get a little bit of shift drag, but their fatigue management is pretty good. So you don't really want to be doing more than 12 hours. If you've got very good planning and you've got great resourcing and you've planned for the amount of animals that you can deal with, then you should be able to keep going on the schedule that you've set, but don't be doing really, really long hours. It is just going to ruin your business continuity, but most importantly, your people. We want to also have a look at logistics. Evacuation and transport is a specific part of our plan. And so here we want to think about every day, those animals that are coming in, if we're a small animal, do we have a crate that sits next to their cage with a label on it? That's everyday preparedness. The minute it's admitted, you can do that and it's going to make your life so much easier. And also having some spare cages there, ready only for evacuation, leads, halters, lead ropes, all of those factors. What is it that you need for your organisation? From a transport point of view, we want to think about our floats. Are we fueled up? Do all of our vehicles have at least half a tank of fuel at all times? And are they fit for road travel as well? Sometimes we have the old trailer out the back we don't look at for 5 years and then we all of a sudden need it. Is it ready to go? Do the tyres, are the tyres fit? So on and so forth. If you can't do that because you might not be able to evacuate, particularly if you've got a teaching facility and you've got herds of animals, and then you're talking to your farm staff there at the hospital, okay, let's make sure we open up those internal fences. What is it that we're going to do to prepare for that? I'm sure you're all aware, but please do not let livestock out onto roads or do let any of your staff do that. So we also want to factor in some sustainability. Let's make sure that we are responsibly using all of those plastics that we have in practice. There's many different ways that we can do that. Please get in contact if you want to talk more about that. Logistics, we want to have a resources list. So here's the good news. You can use an edited version of your asset list that you've already got to know exactly what you can fit into your clinic, how many animals that you can see and look after. Okay, here's the funny one, the one that you can use not just for disasters, but lots of times. So a list of all of your, this is for the management copy of the plan, a list of all of your accounts, login details, PINs, keys for the oxygen shed, because it has happened before, where the keys, I can't get in, and of course your fences as well. Okay, when we're thinking about alerts and warnings, the key points here are to know what your triggers are to activate the plan. And so this is going to change depending on the area that you're in, but know where to find your alerts and warnings for your area. When we're talking about planning and practicing, we want to have exercises to test our knowledge and understanding. And if you do need a hand with that, please get in contact. I'm very happy to help you. You want to recheck that plan annually, replenishing your kits every 6 months, or perhaps more often, depending on what you're putting in them. And of course, checking all your transport gear, as we talked about. Socialize any of the changes with this team. You might find that you need to remind every 6 months or a year, seasonally as things are coming around, here's our roles, here's our responsibilities, here's a short executive summary of the things we need to know. Let's read this together and get prepared. That's the picture there of the field guide for Australian veterinarians. So first preparation, easy step. So our veterinary emergency response teams, we talked a lot about these the other day, so I'm just going to leave that there for a second. On a beautiful, perfect day, this is exactly what we'd have. The only thing I really wanted to get you to pay attention to here is that, we need to, when we're assuming control for the particular position we're taking on, we need to make sure that we are wearing ID, particularly as the coordinator and team leader. And then all of the other positions in our teams should also be identified, particularly if you've got a very large team, you've got 20 people, hopefully you'll have a leader for 5 to 7 people each, but make sure that you're all ID'd, even if that's just a badge or your name on your surgery cap. The use of the title officer in our nomenclature is not recommended, and my rationale for that is because of our veterinary officers at the state level and also our Chief Veterinary Officer of Australia, because that links in with other emergency animal disease and other contingencies. So let's go into response now. So this is another part of our plan. And here we're going to look at the phases of response. So alert, standby, some triggers to activate, how you're going to activate, and when you're going to be standing down as well. We want to think about our equipment cache here, our PPE, and also our safety gear. Take note of species-specific handling, holding, and of course that fear-anxiety scale and what specific animals will need. There's some things we may choose to do or not. Again, please make note of this in your plan. If you don't do it, it's okay. Have a contingency for who does. So animal search and rescue, disaster triage, either at the hospital or externally too, out in the field. Decontamination, that's recommended irrespective of where you are. You can make those kits together and get them ready. Quarantine areas, perhaps your isolation ward's not big enough, so you might need to create a new one. Treatments may change as well. So drugs that you're going to be using, the dosages, maybe your regular vets aren't there that know all of the doses off by heart. What is it that you want to use in that situation? Make that really clear for people so it's helpful, and the treatment orders as well. Now, with consultations, say that you've got extra consults on, things have been going on for a little while and you're now ready to receive some extra animals for consults, whatever the case is, please use your veterinary nurses where you can. I know that this is going to be new for some veterinary practices, but it's really going to help you with your resourcing. So with a risk assessment and of course having some double checking and contingencies in place, this can work really well. Please take note that you are going to have an increase in behaviour consultations. So please do link in with your veterinary behaviourists. And of course, if your nurses can do part of that, that will be helpful as well. Refer, refer, refer. Unless you're the big specialty hospital, make sure that you're taking those animals and sending them on as soon as they are stable to travel. Only taking what you can, know your triggers to move those animals on, particularly with wildlife, because we don't want those myopathies we've heard about and all of the other issues that can ensue. They need that specialist level care. So we want to know how we're going to transport. Where is that set up? Is that an external party we set up an MOU with? And our high acuity cases, we want to, of course, focus on particularly around burns patients, flood patients, whoever needs specialist care, going to those emergency and specialist hospitals, or of course for wildlife going to their wildlife hospitals. For low acuity, we want to think outside the box a little bit, as long as it's safe and people can assist. So a lot of our shelter owners and shelter staff are very used to giving medications orally. Can they take some of the low acuity animals on? You want to think about this before it all happens. My other point for here is mortality management. We want to be making sure that we've got some contingencies in place for when we start to see excess of bodies. Now, do link in with your cremation companies here, and also link in with local government, because they do a lot of that waste management. Check in with your incident command system, whoever your upper report is, and say, this is what we're dealing with. We've got some environmental potential risks here. Please help us with this. Please swap your staff doing the body management as well. It is I would say stressful. It is an arduous task. In terms of rescue, if we're going out into the field and we're helping out in teams, we want to think about a multi-agency response and how we fit into that. And this is where we're going to need some training to do that. Safety always comes first. So thinking about yourself first, it's okay to do that in rescue. Then we think about our team, and then we think about the victim that we are looking after. Because if you're not fit and able, then we may have to pull the whole team. And also that's going to also hurt the victim potentially as well. So let's be prepared around that. Think about the expertise that your veterinary personnel can offer. There's a lot of other things that not just the vets, but other staff can come in and assist with. So behaviour, handling, distance and close exams and monitoring, sedating under, of course, veterinary supervision, and other meds that those animals might need. So if you're not going to do, as I keep saying, large animal emergency rescue, but it could be small animal technical aspects of rescue and lots of other scenarios, that's okay. Just put it in your plan. Yeah, there we go. Okay, and also the other point as well, speaking of David King and his amazing photo there, there are some amazingly experienced people in Australia. So if you do need help and you get a call and you're just not sure what to do, put that in your plan ahead of schedule. I want to almost dob David in there because I'm pretty sure he'd be very happy to help you. But there's more than David. We have plenty of people who can assist. Now, recovery, the last part of our plan. Now, we want to think about recovery from the moment that our response actually occurs, so that we can start to think about our people and our resilience, and of course, business continuity underpinning everything. So patients recovering from our disasters can take months. Up to 2 years was the data from my research quite a few years ago now, but generally speaking, we want to prepare for that with the organisations around us. So refer those patients on and have some plans in place. It doesn't stop once you refer those patients. We still obviously need to check in and assist other organisations where possible, particularly if they're not veterinary personnel. So I'm talking mostly about wildlife carers here, or rehabilitators. Share that patient load, discharge, refer where you can, know the triggers to stop your practice's response. For example, no more admits. Do this all in liaison with your incident command system and your lead animal emergency support organisation. Local government, as I mentioned, have the recovery lead, and of course, Red Cross do a lot of the reunification in evacuation centres. I suggest that there's more work ahead there for us, particularly as we need to try and reunify owners and people together as well. That can be a future us thing that we look at. We also want to have a post-incident analysis. They call this lots of different things, but that's just one of the terms. We want to think about where we can improve and keep building on that plan and our knowledge. Put that information into policy and plan your SOPs when you learn it. It'll help to keep it in your business and start to build that maturity around the experience level of the organisation. Have ongoing support for your team, their families, and of course your clients, particularly if you're extra close-knit communities. It's really going to weigh on you heavily. Again, this is another role where our vet social workers can assist us. So lastly, let's look at our kits and training. I'm not sure how I'm going for time, so I hope I'm not over. Have at least an emergency shelter in place kit and an evacuation kit. Again, that will look different to every practice. Make sure you can cater for the animals that we have in. Include medications and your drug record books. Make sure you cover off the legalities, particularly if you're taking S8s out of the practice. Now, veterinary response kits, this is depending on what you choose to do as an organisation, and this may evolve over time. Don't forget all of your safety equipment there. You will need specialised training if you're going to be using dart guns. And of course, if you've got guns already, then you'll have some very specific rulings around that. And remind your team that we're only really resilient if they can actually plan and be prepared at home as well. With our training, there's a few areas there that we want to train in. So incident command training, bushfire safety awareness, any induction we can do, particularly if we're going out into other teams, team leadership, large animal emergency response, triage and treatment as well. So in summary, planning and practicing, working with other stakeholders to achieve quality emergency management. Establish those kits to address what your plan entails and take note of the specific areas of animal emergency management. Put them in your plan, create contingencies even if you aren't going to do them. Take a proactive approach to wellness for your team and know your triggers to evacuate and facilitate each part of your plan. Work with your clients and your team to prepare at home. Community engagement is a huge part of this. Train in all of the things we just mentioned. And please take note that with Australia's animal emergency management, we are really still evolving and growing here. So care should be taken as we integrate our nomenclature and also our professional practice, particularly in those multi-agency scenarios. Some words have the same more than one meaning depending on which discipline you're from. So in a disaster, it is so true that you will go to what you know. So please make sure that that's your really well prepared plan and you'll go so much better and have resilience. There we go. That's just the note there about Susie's and my disaster planning workshop. So if you are a veterinary practice and you do want to work with us to get prepared, we'd be very happy to help you. Our contact details are there. That is it for me today. Thank you.
Thank you so much, Erica. Great information. I'm so glad we're recording this because there's a lot of notes to take, and I don't think any of us were writing that quickly.
I spoke
we do have just about 2 minutes, so very quickly. We do have a couple questions. Is the Australian Veterinary Disease Book available for purchase?
You don't need to purchase it. My understanding is that you can, well, I've recently looked at it and you didn't need to buy it then. You can go online and download it. That will be available through Department of Fisheries and Forestry. So that's DAF. Do email me. I will send you the link for it. But yeah, just print it. That's the first thing you can do. It's very easy.
Wonderful. There was another comment just to add a little emphasis. Please investigate what emergency plans currently exist for your area and determine if they have tried to meet any of the needs you feel should be in the plan you are considering. Work to collaborate and improve, augment an existing plan before starting something new. Yes. This also helps to ensure that your planning is more likely to actually be considered in the official emergency response and integrated.
Yeah, perfect. And that's true because we often do have many iterations of plans, and particularly if you're new and you're very passionate as well about it, do invest and make sure because it's all change management at the end of the day and culture.
Absolutely. And finally, what is the role of Animal Health Australia in this?
Yeah, such a good point. So Animal Health Australia look after our emergency preparedness with wildlife. And we've actually got another conference coming up in just a few weeks in Perth, and they will be talking there as well. So I think they've actually got an online admission. So if you want to have a look, you can certainly listen in. I believe we've got some very, very good speakers presenting. So I think they're probably better to talk about all of the things that they do. But yes, they have responsibilities associated with emergency animal disease in that area.
Wonderful. And then if you can give us just perhaps 30 seconds, can you say a bit more about the veterinary social worker role in terms of
Yes.
What level of training is needed? Is there any training available? Does it include human psychological first aid training or skills or something similar?
Yes, absolutely. So the Centre for Veterinary Social Work in America, I believe, was recently launched. And in Western Australia, we have just recently started the Veterinary and Community Care Charity. Now, this group is helping to induct this role into Australia. We do have a couple of veterinary social workers here already. They are social workers who have a degree level and have then gone on to do an extra qualification, usually from America, and they have then become a qualified veterinary social worker. So they have unique skills in being able to counsel, link people to other services that they might need, and also helping our people to debrief and have support as well, of course. So a big part of what they've got in their skill set is being able to decompress and de-escalate those issues associated with clients who are going through some really big emotions, quite understandably so, because of, you know, the experiences that they're having with their animals having trauma. And so as the training kicks off in Australia, our plan is to, when I say ours, I mean VAC, I do a little bit of work with them as well. So for VAC, Veterinary and Community Care, the idea is to get training organised in Australia. It is very new. We've only got a couple of them at the moment, a couple of veterinary social workers, and in time, the hope is that we can get more and more people qualified and get them practicing through teaching vet hospitals, not just in Western Australia, but throughout Australia as well. So please do go and have a look at the Veterinary and Community Care website. They've got a wealth of information on there, and very passionate people who care a lot about both people and animals. So I feel that they can probably answer your questions a lot better. I believe Wendy Till is probably the best person to speak to. She's an incredibly experienced veterinary social worker.
Wonderful. Thank you. Well, please, just for the next couple seconds, put your contact information back up on the screen. Sure. And we are actually just about a minute over, so we'll be moving right into our next presenter. But Zoom does require us to log out to stop recording the session and then log back in to start. So please join us back here just about 90 seconds using the same Zoom link that you used for this session. Thank you so much for being with us today, Erica, and we look forward to seeing everyone in the next presentation.
Thank you.